recognizing that all of the Tennessee counties, all the Tennessee Appalachian counties are in central Appalachia. But I'm going to subtitle the talk, How High is the Wall in Your Town? And hopefully by the end of this presentation, you'll have a sense of what that means and what each of you can bring to improving health. Now I want to start, of course, with a quick overview of Appalachia, because when we talk about central Appalachia, sometimes folks have different ideas of what it means. It obviously is this ancient mountain range that runs up and down the eastern seaboard. If you're a hiker, you know that the Appalachian Trail runs from Maine to Georgia. But according to the Appalachian Regional Commission, it actually runs from southwest New York to northeast Mississippi. About 420 counties in 13 states, all of West Virginia and parts of 12 other states, about 23 million people, and don't take notes, I'll give you any of these things that you want, because really this talk is more about concepts than facts. Okay? 23 million people, about 1 in 12 Americans live somewhere in Appalachia, but they are twice as likely as the nation to be rural, and about 50% more likely to be poor. But for today's discussion, I'm going to focus on a subset of Appalachia. And those are the 238 counties of central Appalachia. This is a map from the Appalachian Regional Commission, and these mauve, yellow, and I don't know what you call that, reddish, dark salmon color, are those three areas of central Appalachia. It represents all the Appalachian counties of Kentucky, North Carolina, Tennessee, and Virginia, almost all of West Virginia, about half the Appalachian counties of Ohio. About 1 in 30 Americans lives where we live in central Appalachia, and about half of these counties are distressed or at risk by the Appalachian Regional Commission. So let's look at this graphically. These are the 238 counties right there. If I superimpose unemployment rate, you can see that we tend to be worse than the rest of the region. If I superimpose lack of educational achievement, you'll see that we tend to be worse than the rest of the nation. If I superimpose poverty, again, worse than the rest of the nation. If I superimpose the distressed counties of Appalachia, you can see that this is the region. Right? So this is what we're talking about. All of the Tennessee counties, all of you are from one of these counties in central Appalachia. And this is also the region that the country thinks of when they think of Appalachia. The image of Appalachia used to be a fairly favorable image of people that were working hard, struggling against some geographic challenges. The national image of Appalachia has changed though over the last couple of decades, driven largely in part by the media, television, and so on. And unfortunately has gone from one that's relatively sympathetic to one that's less so. And I used to think it really didn't matter what people thought about us, because Frank, sticks and stones and all that stuff. But actually I came to realize that the public perception of us does make a difference. And that realization came to me in watching a show that you all may have seen called Moonshiners. How many of you have not seen Moonshiners on TV? All right. Well, it's a show that begins with the tagline, "In Appalachia, moonshine is considered by many to be a way of life." So I was giving a talk recently in Washington, D.C. about central Appalachia. And I said, how would you feel if there was a TV show that began, "In Washington, D.C., dealing heroin is considered by many to be a way of life"? It's somewhat offensive in and of itself, but the real reason it became important for us to pay attention to the image. This is, and for those of you that haven't seen the show, this is Tim and his still hand Tickle. They are from central Appalachia and they make moonshine. The first season was largely about them. And the reason it became important to us is early in the first season they had an episode where Tim and Tickle went outside to shoot his automatic weapon. So here's Tickle smoking a cigarette with his automatic weapon next to the truck they used to carry their moonshine, which isn't in and of itself a particularly good public health image. But who should walk into the picture but Tim's son? Well, you may question the propriety of an underage kid on a show about moonshine, but to make it a little worse, he was wearing an East Tennessee State University. Every other logo they blot out. For some reason, they must not have figured it. So we're waiting to see if this has a positive or negative impact. But the idea is you begin to realize that these things do matter, okay? The image of Appalachia does matter because people judge us. So I want to propose a different image of Appalachia, one that's much more consistent with what you all know. And that's a region of incredible natural beauty and a deep and rich culture and heritage. One of the best places in the country to live. Great weather, low cost of living, a good healthy environment, people that stick together and support each other. That's the image of Appalachia that we all understand. But it's also an image that includes an unfortunate aspect, and that is that we suffer some health challenges in this region. And that's really what I want to talk about today. What are the health challenges that prevent all of us from enjoying this incredible quality of life that we have here? So the health status of Appalachia, I'm going to pose and answer two questions, both what questions. What is the health status of Appalachia, and what can be done about it? That's really the purpose of this meeting, right? Each of you wants to go back to your communities and make a difference in the health of your community. To understand the health status of Appalachia, I want to take a step back and talk about the health status of the United States, because it's important to have us in context. And when we talk about the health status of a country, there's a lot of different ways to measure it. Right? If I was asking the health status of this room, I'd ask you how, fever, cough, cold, and all that. But for a country, it gets a little more complicated. And so typically one of the measures that we use to measure countries is life expectancy. Life expectancy is the most basic, fundamental measure of health. Right? Everything that goes into your life is reflected in life expectancy. How healthy is mom when she gets pregnant? Does mom have prenatal care? Does she use alcohol, nicotine, or other addictive substances during pregnancy? Is that baby born in a safe environment? Does the child have adequate food and clean water? Do they grow up in a country free from war and famine and civil strife? Can they get an education? Can they get a job if they get ill or injured? Do they have access to all of that times 310 million is life expectancy in the United States. Okay? And if we went out on the streets of Greenville, or Johnson City, or Unicoi, or wherever, and we asked the man on the street to tell us two things about life expectancy in the United States, he'd tell us, first of all, that it's probably the longest it's ever been. Here the man on the street would be right. Life expectancy in the United States in 2012 was about 78 and a half years. The average baby born in the United States in 2012 is expected to live 78 and a half years. That represents the longest it's ever been. If you look at the 20th century, life expectancy went up a phenomenal 30 years. Think about that for a second. From the time my grandparents were born to the time my youngest daughter was born, 3 generations, life expectancy went up by 3 decades. That's really phenomenal. The second thing the man on the street is likely to say is that life expectancy in the United States is probably the longest in the world. He knows that we're one of the wealthiest countries that has ever existed. We've got a healthcare infrastructure that's the envy of the world. We train our professionals better than anyone in the world. Keep believing that. But here the man on the street would be wrong. Okay? In 2012, the United States ranked behind all of these countries and ranked 33rd in the world. Almost 3 dozen countries where a baby born today is projected to live a longer life than a baby born in the United States, including countries like Germany, Jordan, the United Kingdom, Greece, Malta, Luxembourg, Portugal. So almost 3 dozen countries that do better at this basic measure of health than does the United States. As worrisome as that is, if we look at all 50 states for life expectancy from Hawaii down to Mississippi, and we highlight those 6 states of central Appalachia, we see that we tend to fall towards the bottom. If you look at all the countries in the world from the 25th to the 75th, the 6 states of central Appalachia start about here: Bahrain, Sri Lanka, Ecuador, Qatar, Croatia, Slovakia, rise up to Mexico, United Arab Emirates, rising up to Libya, Chile, and Cuba. Hardly the place we want to be compared to on an international basis. But as worrisome as that is, this in fact underrepresents the health challenges of Appalachia, because the majority of these states are not in the Appalachian region, right? So if we were to look at this, only 11% of the population of Virginia lives in the Appalachian areas. Only 8% of the population of Ohio, 19% North Carolina, 44% Tennessee, 29% and 92%. Only 22% of the population of those states actually lives in the Appalachian counties. So we have to take a different look. We can't just look at the states, we have to start looking at the counties. And to do that, the statistic that we'll use is premature mortality, which is related to life expectancy. It's basically years of life lost before age 75. So it's comparable. And I could go into the details, but just take it for a moment. These are all 50 states for premature mortality from America's health rankings. You can see there again, the plus near the bottom. But those, again, that's all the states. So now I want to look at those 238 states. This is a little complicated, but it's really important because it'll give you a visual image of health in Appalachia. What I'm going to do is take all 3,144 county sites of the county health rankings in America and compare them to premature mortality. Okay? So all the counties in America are laid across this map. A low number is better, a high number is worse. So the average county in America has a premature mortality of 8,000. Don't worry about what the number means, just think of the comparison. A higher number is worse, a lower number is better. The top 10%, about 5,500, the bottom 10% started at 1,100. So even within this 80% of counties in America, we see a doubling of premature mortality. Now I'm going to drop the top 10 and bottom 10% off for statistical reasons. This is the same chart, okay? This is 80% of the counties in America for their premature death rate, the chance of someone dying young. Now I'm going to put the 238 counties of Appalachia on top of this. What you can clearly see is across the board, we are less healthy than the rest of America. To give you a way of looking at it, if you look at our average county, okay, 83% of the counties in central Appalachia are worse than the national average. 8 out of 10 of our counties fall in the bottom half of America for this statistic. Half of our counties fall in the bottom quarter. Does that make sense to folks? So now you can look at this, and anytime you see a gap between those 238 counties and the 3,100 and some counties, you can see that central Appalachia is less healthy than America. The median, we're about 21% less healthy than America as an average. Okay, that makes sense. Now this is a pretty statistical way of presenting this. I want to present a different way that might be even more graphic. In 2008, Gallup Health Weights listed all of the congressional districts in America. This is now congressional districts, not counties. The 4 least healthy congressional districts in the country in 2008. The 4th least healthy was Tennessee's 1st congressional district, that you're sitting in now. The 3rd least healthy was Virginia's 9th congressional district. The 2nd least healthy is Virginia's 3rd congressional district. And the least healthy congressional district in the country in 2008 was Kentucky, right here in central Appalachia. So however you look at it, we are in a part of the country that is less healthy than the country that ranks 33rd in the world for life expectancy. Does that make sense to folks? So I started by posing these 2 questions. What? Why? And I suspect at this point most of you are asking a different question, which is why? Why should a baby born in Appalachia be more likely to live a shorter life and have worse health statistics than a baby born in most other states and in dozens of other countries? Because we know, why do we have health statistics less than we could achieve? We know we could achieve them, right? Because other states are better than us. We know we can do that. Other countries are better than the United States. We know we could achieve it. This is not an unachievable thing. Why do we have health statistics in our region that are less than we could achieve? And to understand that, let's take a step back and talk about health status in the United States. In 2007, an article was published in the New England Journal of Medicine that asked a simple question. And that is, what are the things that cause us to die young? You know what causes us to die young, you know what the issues are that are killing us and causing us to die young. Now this is not the causes of death, right? The causes of death are heart disease, cancer, stroke, chronic obstructive pulmonary disease, and accidents. 2/3 of us will die of one of those 5 causes. 2/3 of us in this room, barring unforeseen circumstance, will die of heart disease, cancer, chronic obstructive pulmonary disease, smoker's lung, stroke, or an accident. One of those 5. But these are the factors that lead us to get those. What are the factors that cause us to get heart disease, cancer, stroke, chronic obstructive pulmonary disease, and accidents? According to the New England Journal of Medicine, the factors that cause us to die young, premature death, first is genetics, what we inherit from our parents. Then environmental exposure is a small wedge. Social circumstance, the conditions that we live in. And this leaves 2 wedges. And it often surprises people to learn that the smaller wedge is healthcare. What that means is if all Americans had access to the very best healthcare, we reduce our early death rate by about 1/10. Now that's important. We want to do that. But the reason I want to make a point about this is those of you from rural communities sometimes think that the only way to improve health is to get doctors and hospitals and clinics in your community. That's important, but there's factors that are actually more important. Things that you can do that are not nearly as expensive as trying to get health care in your community. And the big wedge, of course, is behaviors, things that we do ourselves, right? And we'll come back and talk about what they are. But let's ask a simple question. Of these things here, which ones are relevant in Appalachia? Is genetics the explanation for why we're less healthy than the country? Now, there's actually a rational reason to ask that question. And it's based on this idea that most people think that Appalachia was populated from people moving east to west. And so we go west, young men. Actually, we were populated more from people moving from the south, from the north down. And particularly the so-called Scots-Irish. If you look at the distribution of Scots-Irish in America, you'll see a cluster right here in central Appalachia. Folks that came from Ireland to Pennsylvania. These three folks here are all from Pennsylvania, so they're part of the migration to central Appalachia. So there's a reason to ask, maybe there's something about our genetic inheritance that makes us at risk of dying younger than the rest of the country. And I can't disprove that, but I can give you one piece of information that suggests it's probably not true. Okay? And it's information that comes from this woman, Bess Brown Cooper. She was born in Sullivan County, just a few counties north of here, in 1896. Same year my grandfather was born. She graduated from East Tennessee State University in 1916. She was our oldest living alumna because we know from January 2011 until her death in December 2012, she was the world's oldest living person. Not the oldest person from Tennessee, not the oldest graduate of ETSU, the oldest person in the world. And until yesterday, one of only 8 people ever known to reach the age of 116. Yesterday, the world's current oldest living person got to 116. We won't sing happy birthday to her. And this doesn't prove anything except to suggest there's probably nothing wrong with this genetically. Okay, if we can produce the world's oldest living person, genetics is probably not the explanation. Well, maybe the explanation is bad health care. Maybe the reason we're not very healthy in Appalachia is we have bad health care. Well, the truth is, just like everywhere in the country, we have areas that are underserved, however you define it. But what's different about Appalachia than the rest of the country when you look at these underserved areas, I'm going to put a map of the population distribution of big cities onto this now. And what you can see is out west they have a real problem. If you're in an underserved area, you're a long way from the city. But in Appalachia you're not. You're reasonably close, with the exception of some parts of West Virginia. We're all within driving distance of access to health care. So even if an individual county doesn't have access, the people that live there do. I'm not going to go into this. A chart that the Appalachian Regional Commission came up with that shows the lack of distribution of health care. You can see we do have some challenged counties, but we also have some of the better served counties in the country. So while health care accounts for some of it, it doesn't account for the majority. What about behavior? Well, we know what the behaviors are, right? The Centers for Disease Control tells us the things that cause people to die young in America. Tobacco is number one. That's not a surprise to anyone. Followed by obesity. And then it drops off reasonably. Alcohol is next. Infectious diseases, about 3%. Toxic agents, environmental pollutants, and so on, 2%. Motor vehicles, self-explanatory. Firearms, self-explanatory. Sexual behaviors that leads to diseases like AIDS and illicit drugs. These are the things the CDC says we die from in America. So let's look and see if these are relevant to Appalachia. Tobacco, as you all know, has been slowly decreasing since the 1960s, but it's been decreasing less rapidly in the Appalachian counties. If you look at Appalachia compared to the rest of the country, you can see a pretty significant difference. Much more likely to be smoking here. 9 out of 10 of our counties are in the bottom half of the nation, and 2/3 of our counties are in the bottom. So clearly, if we want to improve health, one of the things we need to do is reduce the rate of smoking, particularly among young people. We know that 90% of people become addicted to nicotine and start smoking before the age of 18. As David Kessler said, tobacco is a pediatric disease. We have to think of it as a disease of children. We have to address it as such. As far as obesity, it's the second leading cause of death. show you a map. If you haven't seen this, I always tell the students I've seen the United States. This is 1986, and the states that are light blue have less than 10% obesity. The states that are darker blue are 10 to 15%. In 1986, there's not a single state with more than 15% obesity. Right? So we put this map into motion in 1987. We get more and more data. The states that were white had no data back then. Then in 1991, for the first time, we have a state with 15 to 20%. Tennessee joins our group in 1993, drops out in 1994, comes back to state in 1995. Then in 1997, for the first time, we have states that are 20 to 25% obesity. Tennessee joins our group in 1999. And in 2001, Mississippi becomes the first state with 25 to 30% obesity. Tennessee joins that group in 2004. And in 2005, for the first time, we have states over 30% obesity. Keep your eye on Colorado out there. In 2009, it's the last state with under 20%. By 2010, every state in the nation has more than 20%. So in the course from 1986 to 2010, we went from having no states with over 15% and no states under 20%. That is a classic epidemic map. In 2011, the CDC changed the way they collect the data, so they insisted on changing the colors. Unfortunately, this is the way it looks today. And you can see that the Appalachian region, not surprisingly, is among the least healthy in the nation. If we look at all of our states, there we are. If we look at this map, there we are. You see consistently across the board, 80% of our counties are in the bottom half, and almost 2/3 of our counties. So I'm not going to go through the rest of this map, but this is pretty much where this talk would have ended about 5 or 10 years ago. I would have said to you all, okay, look, we've seen what has to happen. We need access to health care, and we need to change people's behavior. And that's where we would have ended. But now we're increasingly coming to understand the importance of these social circumstances. Okay? And this is built on this idea that our health isn't just what we inherit from our parents. It's not just access to health care. And it's not just the behaviors that we engage in. It's also impacted by the environment we live in, right? And you look at this list, and every single item up there makes sense to you. You know, the early life experiences do dictate how healthy you are. If you live in a dangerous community with a high crime rate, your health is going to be worse. If you have a job that's physically dangerous, your health is going to be worse. All of those make sense, but what you may not realize is how incredibly strong these relationships are. So I'm just going to show you two of them. And the first is income. The relationship of poverty and health. Now, all of you, if I ask you to think of the least healthy countries in the world and the poorest countries in the world, chances are you have the same countries in mind. And you'd be right. This is a map from a chart from 2004. It shows all the countries in the world. The size of the country is based on its population. There's China, there's India, there's the United States. The color is the continent that it's on, Asia, North America, Europe, and so on. There's Africa down there. Now the chart is wealth. This is gross national income, per capita income. So rich countries are over here, poor countries are over here. In this case, the way we're measuring health is the chance of a baby dying before their 5th birthday, under 5 months. In 2004, the poorest country in the world was Sierra Leone. They had an under 5 mortality of 300. That means for every 1,000 babies born alive, 300 would die before their 5th birthday. That's stunning when we think about it. At the same time, the healthiest country in the world was Sweden, with an under 5 mortality of about 3. So 100-fold difference in the chance of a baby making it to their 5th birthday defined by wealth. Now this is not inconsistent. This is how most of you think about health. Most of you understand that poverty is tied to poor health. What you may not realize is that this relationship also exists in the United States. So this is a chart that shows what your chance of dying before the age of 65 is based on your income. So if you have, and this is a relative risk, we call it. Don't worry about the numbers. So if you're wealthy, your chance of dying is considered to be 1. And you'll see for every group, every income group, the more poor you are, the more likely you are to die before the age of 65. And in our country today, a poor American is 3 times more likely to die before the age of 65 as a rich American. This becomes important to us in Appalachia for two reasons. One, we have higher rates of poverty. I've got my arrow. So if you look at the 6 Appalachian states, look at the Appalachian counties, almost 9 in 10 of our counties fall in the bottom half of the nation in poverty, and half of them fall in the bottom quarter. So it's important to us, first of all, because we have higher rates of poverty. But it's also important because the gap between rich and poor is widening. And let me show you that statistic. This is data from the Census Bureau. It divides all Americans into fifths. So this is the poorest fifth of Americans and the richest fifth of Americans. This is income over here. It's constant dollars over time. So this is 1971, 1981, 1991, 2001, 2011. What you can see, for the poorest fifth of Americans, from 1971 to 2011, their income went up by 8.5%. At the same time, for the richest fifth, this is not the top 1%. This is fifth. So one table here represents the richest fifth of you in this room. I saw which table. But we will talk about donations later on. So over the course of that same period, they went up by 51%. So the ratio of the richest fifth to the poorest fifth went from 11 to 1 to 15. Now, I don't put this up to make a political comment, because I'm not a political person. And I don't put it up to make an economic comment, because I'm not an economic person. I put it up to make a public health comment, which is if you believe, as I do, that poverty is tied to poor health, what this tells you is that those parts of the country with higher rates of poverty, like Central Appalachia, are going to see a widening gap and not a narrowing gap unless we figure out how to grow the economy. Right? So we do have to create jobs, we have to get opportunities for people, we have to get people out of poverty to make a difference in this, because otherwise we're going to see widening gaps and not narrowing gaps. We're going to see a worsening of the health situation and not an improvement. And I'm not going to show it to you, but if I show it, I do have a slide that shows you the top 5%, the top 1%, the top 1/10 of 1%, and I can tell you the gap is widening across the board. So that's income. The only other one I want to show you is education, just because it's an important statistic. This is an interesting chart. It says, okay, by the time you're 25, how many more years are you going to live on average if you're less than high school graduate, some college, or a college graduate? Okay? By the time you're age 25, 5 years for women, almost 7 years for men. So in other words, education is tied to health. If you have a friend or a colleague who has a child who's considering dropping out of high school, you can tell them if they stay in and graduate college, not only on average will they live 5 to 7 more years, they'll make $1.1 million more in their lifetime on average. So staying in school can make you a millionaire and live long enough to spend. But the point in this is that this is important to us in Appalachia for 2 reasons. One, we have low rates of school achievement. This is one time where higher numbers are better, and you can see again that we are in fact lower. Almost 9 in 10 of our counties fall in the bottom of the national nation, and 2/3 fall in the bottom quarter. Here again, this is important because there's evidence to suggest that the gap is widening and not narrowing. Let me show you this. This is an interesting chart, and it asks the question, if you take a group of high school sophomores, how many will have a college degree in 10 years? So how many kids will complete a 7-year academic journey in 10 years? What it comes down to is the parents' educational level. The parents, the children of professionals, 3/4 of them will have a college degree in 10 years. If the parents are high school dropouts, 6%. There's a 12-fold difference. What does that mean? That means parts of the country that have lower rates of educational achievement are going to see another generation with lower achievement, and over time we're going to see a widening gap unless we really focus on improving education. So all of a sudden you realize when you look at this chart, that suddenly if we think about health, whether it's in Appalachia or America, we realize that the entire paradigm that most of us had has to change. It's not just about health care anymore. That's important. But if we really want to change health, we have to change behavior, and we have to increase economic opportunity and education. And all of a sudden, that also means that every one of you in this room knows there's something that you can do to improve health in your communities. A really important point to make is that these things are interrelated. Every employer will tell you they need a healthy, educated, drug-free workforce. Every school superintendent will tell you they need healthy kids, healthy teachers, and they need an economic base to pay for their school. Every doctor and hospital will tell you they need educated citizens who can make good choices about their health. These things are all interrelated. And we can no longer afford the luxury of thinking of ourselves as having different jobs. If you're in education, if you're in economic development, if you're in health, we're all part of the same game. If you put it into words, we need to work together to ensure access to health care, especially prevention, behavior change. We need to work together to encourage healthier behaviors, and we need to work together to enhance economic opportunity for education and achievement. What these all have in common is we need to work together. Really important for people to understand that these are not political issues. Every single Republican, every single Democrat, every single Libertarian, every single anarchist, whatever they are, all of them benefit if we have a healthy, educated, drug-free community. Every single person benefits. This is not an issue for Washington, D.C., or Nashville, or Greenville to solve on their own. These are issues for us to work together on. And most importantly, these are not issues for economic development, educators, and healthcare providers to try to solve. These are things we have to deal with. So when I say this, people typically have two concerns. The first concern is, well, it's not really my job, right? I'm a teacher, I run a small business, I'm an elected official, I'm a dean of public health, whatever. We're all in this together. Every single one of us benefits if our communities are healthy. There's no question. And then the second concern people raise is that trying to improve the health of Appalachia is too big a challenge. We're trying to improve the health of the United States. So early on I showed you this picture. I'd like to introduce you to this guy up here. He was born in the 1850s. Went to college about 14 counties north of here. Went to medical school at the University of Virginia. Then went out and fought in the Indian Wars, came back. And in the early part of the 20th century became a city health officer in Charlottesville, Virginia. And I'm interested in him. That's what he looks like by the end of his career. I always tell students that that'd be fair warning for a career in public health. But I'm interested in him. I have in my office a book called Virginia Health Code of 1908, about the time that he was a city health officer in Charlottesville. And these are the leading causes of death. Tuberculosis, overwhelmingly the leading cause of death, followed by cancer, whooping cough, typhoid fever, influenza, so on. And the reason I'm interested in that is if you think about it, 100 years ago, there were no antibiotics. There were only 2 vaccines, and they weren't for any of those diseases. And yet this guy and a bunch of other people, doctors, nurses, sanitarians, and others, did something really phenomenal. They increased life expectancy by 30 years. The vast majority of the life expectancy improvement in the 20th century took place in the first half, before all the medical advances that we think of as defining health in America. Now this guy is not famous. There's nothing named for him as far as I know. His name is Reuben Lindsay Robertson. He was my great-grandfather. And I often wondered what it would be like to be working at a time where the health challenges seemed too great to deal with. There's another picture in the Virginia Health Bulletin that I think says more to you all as folks trying to improve health in your communities than any other thing I could say or show you. Here's the wall. On one side of the wall are the leading causes of death of the day. On the other side are the rather oddly dressed children of the 19th wave. They knew 100 years ago they didn't have antibiotics, they didn't have vaccines, they didn't have magic force. They knew they could build a wall. Public education, careful physicians, good public health. Today the diseases have changed, right? Heart disease, cancer, stroke, chronic obstructive pulmonary disease. Those of you that are in health understand there's still no magic bullets. There's still no vaccines. There's still no antibiotics for that. But we can be just as optimistic that we can make the same kind of difference for our children as they did 100 years ago. Maybe today we'll call the wall, prevention, access to affordable health care, education, and income. But we can be just as optimistic that we can improve the health of our communities by building a wall, even in the absence of a magic bullet. And the caption 100 years ago was, how high is the wall? If we build a wall, everywhere in the country will benefit, there's no doubt. Every state in the nation will benefit, but probably nowhere will benefit more than we will in Central. I've introduced you to my great-grandfather. That's my son Kevin. That's my son Gregory, my daughter Kathleen, and Andrea. That's my wife, and that's me. And I like to end with this slide to remind you that nothing that I've talked about has anything to do with statistics or politics. It's really whether we, as leaders of our community, will make the kind of decisions that we need to make to give our children a region that is as healthy as it is beautiful. This is the image we use for the College of Public Health. I like to say that, we're not Harvard, we're not Hopkins, but we have something they don't have, and that is an incredible place to live. I look forward to working with you all to identify the programs that you can do in your community to make a difference. I'm happy to answer any questions now, or if you'd rather send me an email, that's fine. I won't answer the email right away, though, because I'm not at my desk. I'd be happy to answer any questions or clarify things.
Yeah. We live in Johnson County, and it was a big farm community at one time. There's an awful lot of cancer deaths in there because I think DDT and things like that at the time. It seems like, is that a factor too?
Yeah, environmental exposures are a factor. I'm sure if you've talked to your local health department, they will tell you that it's really difficult to identify cancer clusters, because what happens is there's 108 different types of cancer, and each has different causative agents. Unless you're seeing the same type of cancer occurring in a large number, it's actually hard to ever ascribe risk to it. But we do know there are some environmental factors.
I mean, because there was so much involved in farming at the time, and that DDT was prevalent.
Yeah, you really have to look and see what kinds of cancers people are getting, and whether they really are clustered. Farming though had a lot of benefits as well. Working outdoors, eating fresh food, and there's a lot of benefits to that. It's hard to measure.
Dr. Nykoff, thank you so much. That's an incredible tour de force on Central Appalachia. One comment about the proximity of healthcare to our population, which makes your point. In my experience in Mercer Springs, Tennessee, in Grundy County, it's not so much the proximity, it's the cost. There's no place where our people can go, where there was one, where there was one physician who, after some 50 years, he's finally given up. But they're going to be charged high dollar, especially the hospitals, and the hospitals are all corporately owned, and if they go to the emergency room, they'll have to pay the rest of their lives. So it's an example of how economics affects healthcare.
No, and that's a very good point. There is a chart, as I mentioned, Appalachian Regional Commission has come up with this evaluation that includes the cost of healthcare. Healthcare has become a very political, the delivery of healthcare has become a very political issue. The desirability of it should not be. We all want what we want for ourselves. It is worrisome that healthcare is now the leading cause of bankruptcy in America. You're right, people accrue great debt to get healthcare. And folks who start off poor don't have the money to spend. They end up going to the emergency room, which is the most expensive way of delivering care.
Or not going at all.
Yeah, or not going at all, going later in the process. There are a lot of very reasonable issues being argued and debated about healthcare. I think we need to keep our eye on the prize, which is we need to figure out a way that Americans can have access to affordable healthcare. Whether it's the current proposal or some other proposal, we have to try to get it. So I usually ask the students, what did I say that you disagree with? because sometimes that'll give me some ideas on how I can change the law.
I don't disagree, but I'm curious when you showed the quintile data, how much movement among the quintiles affected the results of the
Yeah, the question is of those quintiles, how much movement there is known movement. It's about 3 months ago, an article came out. It actually suggests that in our country we have less interquintile movement than in most countries, which is very contrary to what we think of. Folks who are poor tend to stay poor. It tends to be multi-generational. I don't have those numbers with me. There's always some, though. There's always some folks who move out.
I guess my belief is the data that it's more locked in central Appalachia.
Yeah, the thought of the comment was we're probably more locked into our socioeconomic strata in central Appalachia than most places, and I think that's true. You think about what jobs someone can get. There are not a lot of jobs that can make you rich. But it does happen. Moonshine.
Yeah.
Welcome today.
TV celebrity term.
Any further questions? Well, thank you, Dr. Wyckoff.